If you ever needed proof that the media was trying to manipulate you, trying to tell you something to lead you to believe to a certain conclusion, you can see that with the story that we're going to talk about right now. A couple of months ago, we interviewed Andrew Whitney. We talked about Serotivir, and we said it's a promising treatment, and that video was banned on YouTube. They don't want you to see this or hear this. Well, a few weeks ago, Andrew Whitney went with, and I'm telling you, a cabinet officer of the United States government who is a world-renowned brain surgeon and also one of the best-known businessmen in America. And they met with the president and they said, hey, Mr. President, we just want you to have some hope. There is some hope on the horizon. There's a potential treatment for COVID-19, and it's very exciting. And this is based on studies that have been done at Fort Detrick and at UTMB and at MD Anderson and other places. It's based on a compound that's been tested. It should be the good news story of the year. It should have come to you, wow, look, there's a potential plant that has an all-natural treatment for COVID that could solve this problem, and we want to get it tested. That's the story. But that's not what they gave you. The story that they gave you was President Trump is trying to put poison on you because he hates you. President Trump, Orange Man Bad, is trying to force something on you, and he doesn't believe in science and all this other rubbish. And they've done it repeatedly in news stories, international news stories, both here in the United States, Newsweek and NBC and CNBC, you name it. Plus the international papers like the London papers, like the Telegraph and Daily Mail and so forth, have all carried the same story, the same narrative, and they're trying to tell you, no, the president's trying to poison you. Well, we're here with the real story. And I'm here to tell you about the economic war being waged against you that may impact your health, it may impact your finances, it may impact the future of our nation. The good news is we've got Andrew Whitney back. He's going to tell us about a potential treatment for COVID-19, and he's going to tell us the story about what happened in the White House and why this is good news if we can get it through and past all of this cabal trying to keep you from the truth. Welcome, Andrew.
Hello, Kevin. It's great to be back.
You have had quite the trip. I mean, in the past few weeks, you've been pushing testing on your compound. You've been talking to all the right people, working with the FDA and doing everything that should be right. And yet all of a sudden in the past week or so, your name has blown up along with oleander in a way that I've never seen before. I mean, this is a plant that's been around forever, and now you Google it and all you see is oleander. You see Mike Lindell and you and all this. Tell us what happened a few weeks ago.
Well, Kevin, yeah, it has indeed been quite remarkable. As we always like to start these interviews and conversations off by reminding everyone that we're in the midst of a national and a global emergency with this pandemic, and we're all in this together. So all we're all trying to do is find solutions to this problem because it's ravaging families, businesses, communities, the entire economy. It's making our lives a misery on so many levels every day, not to mention the losses people are suffering, and it has to be addressed. So we come at this from a public-spirited approach where we just want to find a good solution. As it happens, we have what we believe is a very safe and effective solution to that problem, but some people disagree.
Right. Well, let's
what
talk
is remarkable.
About that a second.
Yeah.
So we've talked about this before in the economic war room. You've got a treatment that's been around you've looked at it for years, right? In context of Ebola and other things. And you were excited about it and you wanted to get that information out. So a few weeks ago, you went to see the President of the United States with Mike Lindell and Dr. Ben Carson. Tell me, how did you get the meeting, and tell me what happened there?
Right. So we've been in the process of working through the FDA process and all of the regulatory frameworks since April. And in the course of that, obviously, we've been conducting a lot of research, primarily laboratory-based, and increasingly, we have interesting anecdotal data as well. We've now commenced animal testing as well. In the course of all of that, some of our data came to the attention of Dr. Ben Carson. He was able to examine that data and found our argument compelling, because in work we had done with the University of Texas Medical Branch at Galveston, UTMB Galveston, one of the leading academic institutions in this country, the first to sequence COVID-19 in the United States. We had won the opportunity to test against COVID-19 with our compound. The work was fascinating. What they found was an average 20,000-fold reduction in viral infectivity. Now, that's pretty big news. Obviously,
Right.
it's only in a laboratory setting. You don't go rushing out into the streets to claim you've already found the cure off the back of that. But what it does give you is a very strong indication. We were able to share that with Dr. Ben Carson, who found it very interesting. He then did additional kind of diligence on our data and what we believe we had. And that led to a meeting with the president.
Let me ask this. I mean, I'll ask it to the public too. If you had something that looks like a potential treatment and you're at cabinet level and it's done properly, it's properly researched, it's being looked at in the right institutions. I think UTMB has the virology lab of the United States at that location. When you've got that kind of data, would you want Dr. Carson to not share it? I mean, this is ridiculous. When you have that, this is potential good news on the worst disease of the last century, and you say, oh no, he should sit on it? I mean, this isn't an idiot guy. This is a world-renowned brain surgeon. You want him to take it to the president, and he thought it was important to take to the president, right?
Absolutely, Kevin. The bottom line is there is compelling data behind this. This is a very prestigious laboratory producing very compelling results in a laboratory setting. On top of that, this is a product that's already gone through phase 1 and 2 clinical trials in humans, albeit for a cancer application, but it's the exact same compound.
Right.
So it's either safe in humans or it's not, according to the FDA's own standard. Those are published papers. So between those two things and some of the other work that we had done on other viruses, Dr. Carson found that compelling. I should remind you that Dr. Carson is obviously a member of the coronavirus task force.
True.
So it is incumbent upon him to bring things to the attention of the task force. It's part of his job at this time in trying to meet this pandemic. And this pandemic, Kevin, in the last 2 months alone, has killed more Americans than the entire capacity of Madison Square Garden. I mean, let that sink in. And there's got to be something done here, because over the course of the last 9 months of this pandemic, in spite of unlimited power and financial resources, there is not one FDA-approved treatment, drug, cure, remedy, other therapeutic, or vaccine. Not one. So at this point, if something comes along with any kind of compelling support behind it, which is the sort of thing you get from UTMB lab analysis, that is worth taking a look at.
We should look at it. And when we come back from the break, I want to know exactly what President Trump said when you presented him this data and what he said he would do about it. So let's take a break and come back. Okay, Andrew, when we went to the break, I have this compelling question. You present this, you go with Dr. Ben Carson, world-renowned, very successful brain surgeon on the cabinet, on the COVID task force. He presents to the president like he's supposed to. Hey, here's something potential exciting. What does the president say?
The president gave me a number of very penetrating questions about it. He wanted to understand what gave us the impression that we felt there was some validity there. He'd obviously been briefed on some of our data by Dr. Ben Carson, as you say, the former head of pediatric neurosurgery at Johns Hopkins University. Hardly any kind of slouch.
Literally a
these
brain
matters.
surgeon, yes.
Yeah, absolutely. So he'd been pre-briefed in these sorts of things. He asked me a good number of questions very quickly. He's obviously a very, very successful businessman before he became president of the United States, and he knows how to get to grips with these things. We had a very, very interesting exchange on multiple topics, And I was very pleased with the conversation because I knew I was dealing with somebody who understood the inherent issues.
Okay. And did he then immediately promise, okay, this is great, we're going to mandate that everybody takes it, we're going to automatically approve it, I stamp it, it's approved, done? Or did he say something different?
Absolutely not. That would be ridiculous. He actually said to me, well, what do you expect me to do about it? And I said, well, sir, essentially, we just want the opportunity to test it. That is all. Yep. That is all we ask. And the way things are stacked up in the United States, in case you don't know, Kevin, or any of your viewers, is you can't do a hospital test without something called an IND number, which is the right to test under supervised circumstances in a hospital, simplifying the matter. So we need that. And we've been filling in forms and going backwards and forwards. And I've no doubt the folks at the FDA are being highly diligent about all of this. But what I would remind you is we've already gone through phase 1 and phase 2 clinical trials in humans for this exact same compound, albeit for a cancer therapy application before, but it's either safe in humans or it's not. And it's a funny old thing. All the time it was only being used for a potential cancer therapy. Nobody had a problem with it being safe in humans. But the minute it's applied to COVID, now all of a sudden people want to talk about, well, it couldn't be safe in humans. Could it possibly? It's a bit like how President Trump wasn't a racist until he ran for office.
As you make that point, it dawns on me, and it's absolutely the truth, that other than these big expensive vaccines, and when we talk vaccines, everybody says vaccine, and they're rushing billions and billions of dollars to buy doses for a vaccine that's not even proven, and they're telling people it's going to be mandated, and there are schools saying you'll have to take the vaccine, whether it's tested or not. There's this rush because the problem is so great with vaccines, but you take something that's all natural and that has already gone through at least part of the process, and you're working with the FDA, and all of a sudden it is dangerous, it's poison, it's made from oleander, and that's poisonous. What are they afraid of?
It's a very good question, Kevin, because if it's really some trivial, silly botanical, then the sheer media hysteria, which appears to be coordinated, is really quite remarkable. If there's really nothing to it, then why the fuss? But the reality is, there's a claim we haven't followed the process. We absolutely have, and we can prove it. Since April, we've dotted every I, crossed every T, jumped through every hoop. Secondly, there's this narrative that it's not safe. Well, it is an extract of the oleander plant, and it's already gone through phase 1 and 2 clinical trials in humans, and it is deemed safe. And that's published material. It's out there. If you do any degree of background due diligence on this, you will find those papers. We can make them available on your website, for example. They're on our website. So it is safe. And also, I would add to that, there are plenty of things out there that are natural, but if you take too much of it, they become very, very toxic for you, whether it's nutmeg, menthol, rhubarb, alcohol. These are all things we're very familiar with. You take 15 servings of nutmeg, you're not going to be in a happy place. Wow. I mean, that's a serving is a quarter of a teaspoon.
And we have lots of medicines made out of, I think of Botox. That's made from botulinum toxin, which is literally gives you botulism, right? And yet so there are a lot of things. This is a complete take you off onto a narrative to try and distract you from a potential, make President Trump look bad and distract you from a potential treatment. I think that's a ridiculous argument. I think I read something that you'd have to take how many vials of your oleander treatment to get the poisonous amount that would harm you? How many vials?
Yeah. So actually, in our phase 1 and 2 clinical trials that we did in humans under FDA auspices, the product was safe up to 16 times the current dosage. So to put that in context, that's the difference between 70 miles an hour on the freeway and 1,120 miles an hour on the freeway. So 16 times greater than the dosage in the proposed product. It was still covered under that FDA trial. So another way to think about it is the difference between taking one ibuprofen tablet and 16 of them at the same time. You wouldn't do that.
Of course
not.
And
the point is, with our given dosage, you'd have to take 600 doses of it at the same time to have a toxic effect. And in the course of doing that, you'd have to consume an entire pint of oil.
And nobody's going to drink a pint of oil. That's
nobody's going to drink a pint of oil.
Right. So, at the proper dosage, You have evidence to suggest that it's safe. There are a whole lot of other drugs that at an improper dosage are very dangerous, but that we use regularly all the time. They're available over the counter. The aspirin's toxic at a certain level. So this is just a distraction. This is not health experts trying to teach. And by the way, we're not health experts here in the Economic War Room. We're not talking about medical advice. We don't give that. We're talking about a media narrative that's been trying to destroy the president and destroy a potential treatment that's going to impact people.
Yeah, any potential treatment that pops up, we're just the last in a series of them, and everybody's familiar with the hydrochloroquine situation. That was the same thing. I'm referring to it now as cure cancelling. The minute there's any prospect of a cure, the media jumps up and all pounces on it as if in a method of cancelling it. That's what seems to be going on. The coordinated effort is quite remarkable.
It is. It's unbelievable. It's a part of the cancel culture that we talk about all the time. It's the media and the deep state or whatever it is that's trying to manipulate and control you so that you can't get the information you want as a public. And so when we're going to take another break, and when we come back, we're going to talk about what we absolutely can do about this. But you need to ask yourself this question. Why shouldn't the American people know about a promising potential treatment? Turn on CNBC any morning and you'll hear all kinds of potential treatments for drugs, and they talk about the stocks you can invest in and possibly make money from and so forth. But in this one case, COVID-19, for some reason, the media doesn't want you to know that there's any promising news other than these multi-billion-dollar vaccines. So stay tuned after the break and we'll talk about what we can do about it. So Andrew Whitney, you're the vice chairman of Phoenix Biotechnologies, and you have been hit probably with more media coverage than the average American will see in a lifetime. You've been hit with that in a few hours. Tell us, what is the media narrative that's getting out there, the lies that they're telling, and what are your responses to those?
Yes, indeed, Kevin, that's absolutely the case. There seem to be three narratives. First of all, that we haven't followed process and we just sort of shortcut into the White House, blew in there like some sort of tumble, president's taking it serious when he shouldn't. Well, that's just not true, because we followed the process assiduously since April. We've dotted every I, crossed every T, jumped through every hoop, and we still are. But there's a long time that's elapsed between April and now for something that we believe has got compelling support behind it.
And this had years of research prior to April. This isn't, you didn't start from ground zero in April. You took something already in existence that's been looked at for years, and starting in April, you began the process to look at it in context of COVID-19.
Absolutely. We've done 25 years of research into this compound, and it's a first-class scientific team we have. Lots and lots of very serious work on the effects of this compound, both in cancer and now in viruses, and with some very, very promising data and more than 20 published papers on the topic. So the idea that we somehow haven't followed any process or there's no support for this is ridiculous. Secondly, there's this idea that it isn't safe. Well, we've already talked about that. We've already taken it through phase 1 and phase 2 clinical trials in humans with the FDA, and at dosages up to 16 times the proposed dose, I might add. So that's, the idea that it's not safe is absurd. You'd have to take 600 doses of our proposed product to suffer any negative effects from it. Nobody's going to do that. The third thing as well is that there's no proof that this could in any way be efficacious or work. Well, that's just not true either, because we've already done a study with UTMB in Galveston where we showed in monkey liver cells in a laboratory an average 20,000-fold reduction in viral infectivity in the first 24 hours. That's news. Yes, it's in a lab, but that's still news. There was also some initial proof of prophylaxis as well. That is in a paper that has been published. So that's out there too, and you can read that. It was going through the peer review process, but with the that kicked off now, the journal that was going to publish it is now having second thoughts about doing a peer review on it due to the amount of pressure they've seen over this, which is remarkable.
They're trying to keep people from seeing action. Now tell us how, the basic idea of how it works. You mentioned it to me about the envelope. Tell us about that.
So in the course of our research, one of the things we've discovered is that in the presence of our product, the glycoprotein wrapper around the RNA strand in envelope viruses is malformed and or missing certain glycoproteins. That seems to have an effect on the efficacy of the virus. So there are a great many factors that could explain how that occurs, but nevertheless, we've actually seen that in a number of different circumstances and published material on the topic. So that we call that our envelope theory. Now, a number of viruses are envelope viruses, and coronavirus, thankfully, is one of those viruses. So that's what led us to UTMB in the first place. They've tested over 53,000 compounds, Kevin, and ours is one of those. They also did a lot of the work on remdesivir with Gilead.
Right, and so when we're talking an envelope virus, if I understand it correctly, and again, I'm not a doctor, but there's this protective fat wrapping around the virus that kind of protects the virus, and when we wash our hands, we break down that fat, that envelope, and so it kills the virus off our hands. That's why we use soap to wash our hands. Alcohol does something like that too, but we're talking here about something that you all have been testing in relation to it can be consumed by people, and it, like other drugs, could potentially break down that envelope, and that might be why it works, right?
It could well explain why it works, Kevin. What we can say definitively is an average 20,000-fold reduction in viral infectivity when you measure the virus progeny. Because a virus enters the cell and essentially hijacks the cell and uses it to make more itself, kind of like a photocopier out of control. The problem is the cell itself is then not doing the job it should be doing, which is why you feel the detrimental effects of the virus. The virus progeny particles then go on to infect other cells. So if our compound in a laboratory setting can drive a 20,000-fold reduction in viral infectivity, that's big news.
Huge.
The next step, obviously, is to test that in animals and humans. Well, the animal testing is underway, and what we're looking for is the opportunity to do human testing under an IND in a controlled set of circumstances. That is all we're asking for. And no more, no less.
And that's what we've got to get the word out on. They're trying to kill a potential, strangle the baby in the crib is the kind of idea. Kill a potential treatment before it gets looked at, because it's not a highly expensive treatment. It's something that's all natural. It's something, they didn't circumvent the process. They did not violate FDA protocols. They followed those. They did not try and ask the president to do something untoward, and he didn't offer to do anything untoward. Secondly, it has not been proven to be dangerous. They're over the top in trying to tell you, well, it's poison. It's made from poison. A lot of the drugs that you take are made from poison. And the third thing is, it has shown tremendous promise and deserves to be looked at. So I think we're going to start a petition that the media back off and start allowing something as promising as this to at least go through the proper process. Andrew, I think you're doing a great service for America in bringing this out, and I'm sorry for how the media has used a narrative to try and hit the president and trying to keep the American public from learning something promising, and they've used it to attack you, your family, and your colleagues.
Hey, Kevin, I appreciate the opportunity to talk about it. We're all here for the same reason. We just want to get this country better, get the country back on its feet so we can all go back to our normal lives before this virus hit us. The reality is we have something that's all natural. It's available in a plentiful supply right now in enormous quantities, and we would like to bring it to bear. Obviously, we need to do that in a safe setting. We've already gone through phase 1 and 2 clinical trials in humans, so we know it's safe. There's no question about that, and therefore there's absolutely no downside to allowing us to test it. Where's the harm in that? Call our bluff. let's see.
Well, you know, we want our viewers to be able to listen to those actual interviews that you did so they can see the truth and see how things were twisted and manipulated. But we also want them to have access to all of the data that you have. Where can people find, we're going to put it on our website, we're going to put it in our battle plan, but where can people find more about this?
You can go to the company website, Phoenix Biotechnology, all one word, .com.
PhoenixBiotechnology.com. All right, thank you. We've had the executive chairman of Phoenix Biotechnology, who has just been raked over the coals, along with Dr. Ben Carson. How can you do that to world-renowned brain surgeon Mike Lindell and others? Simply because they wanted to tell the president about good news, and they want to get a promising compound properly tested by the FDA, and they've been attacked horribly. This is an attack on you. It's not just an attack on them. There is a media cabal that does not want you to know about a promising potential cure. It's an economic war. It's an economic war with trillions of dollars of implications for you. So you need to go to economicwarroom.com, download your free battle plan. This is Kevin Freeman from the Economic War Room.